24 hours a day. How much would you be willing to reveal?
Do you think you may be addicted?
No.
Would they be shocked by what they find?
That's frankly pretty dangerous.
That looks horrible.
Like most busy NHS GPs, Rangan Chatterjee only gets about 10 minutes with each patient.
Excuse me 1 second, Ollie.
Now he's taking on the biggest challenge of his career.
I believe that 99% of a patient's health outcome is what happens in that time outside the surgery room.
He's about to live alongside individual families who struggle with their health.
Who needs help with what?
Your lower back.
I feel out of control of my own body.
Worried about cancer.
For the first time, he'll gain insight into every aspect of his patients' lives.
This is a unique opportunity. I think I will be able to learn so much. Do they cook fresh foods? Is this how you eat every day?
Pretty much,
Yeah. Is it a noisy street? Are there stressful relationships? All these things have a huge and significant role in determining their health. Go!
He'll detect undiagnosed diseases.
I think you've already got it.
He'll deliver some home truths
Do you get how serious this
It
is?
doesn't.
Yeah. I honestly want to help you.
and discover ways we could all live longer, healthier lives.
I think it really has the potential to change the way we all look at health in this country. It's imperative that we do something about it, not tomorrow, but now.
Saved again. No, it's there. I told you, that's the post. It's over there.
The Ashton family live in Greater Manchester. Ray and his wife Rachel have 2 kids, 13-year-old Chris and 5-year-old Lucas. 47-year-old Ray has a lot on his plate. He's an IT manager for a local NHS trust.
8.
And he also owns a bodybuilding gym.
Perfect, mate. Well done.
What do you do? What do? I look after everybody.
Rachel's very, very caring, very loving.
Hold on. Put it round there.
She's probably the rock of the family, if I'm being honest.
Ray's health has got the family worried. Despite looking physically fit, he's suffered from back pain for decades.
Got to that point where nothing is helping. I can't sit, can't sleep, and I have to sit in a chair upright and try and fall asleep that way. I forgot what it feels like to be pain-free.
In the last few years, Ray's pain has got a lot worse. If he doesn't get it looked into now, things might go to a point where they can't do anything about it.
I mean, I'm very, very close to my children, but I could do more things with them, and I know they'd love it.
Dr. Rangan Chatterjee has practiced medicine for 14 years. Now he's taking a break from his NHS surgery in Oldham to spend some time focusing on the Ashton family's problems.
We're going to get insight into what parts of their life are linked in together. Stress, diet, you know, work patterns, whatever they are, they all feed into health. Hi.
Hello, Doctor. How are you?
Yeah, good. How are you?
Wow, aren't you told? You
I am
duck in
told, yeah,
and
absolutely.
come and meet the family.
Yeah, fantastic.
Okay.
Thank you very much. Cheers.
This is my youngest. This is Lucas Ashton.
Hello, Doctor.
Can I shake your hand? Hi, Lucas. Who are these people sitting on the sofa?
Miss Mum.
That's your mum?
Rachel.
The doctor will be immersing himself in the Ashton household to investigate every aspect of their lives.
What I'd like to do, if possible, is just to try and get a bit of an overview in terms of who needs help with what.
My biggest issue that I've had for the longest period of time is my lower back.
Okay.
I've had my back problems for 20 years plus. When that flares up, that is bad. It stops me from sleeping. And my neck is certainly an issue from an ache and pain sort of thing.
Okay.
But I think it may all originate from my shoulder because it is my shoulder that constantly throbs. So I can sometimes feel it coming right down my arms.
We'll look into all that. Anything else apart from aches and pains?
I've noticed that obviously as the pain's been getting worse, I've become more and more irritable.
I imagine it's not just a few niggles here and there. I'm imagining you've got some serious pain issues.
Ray isn't alone. Over 16 million Brits have suffered from back pain.
Is there Anyone else in the family who needs help with anything?
Lucas has got really, really bad skin, and we've been under different consultants, different doctors, hydrocortisone cream, you know, other lotions and potions.
Lucas has eczema, a skin condition resulting in a painful, itchy rash.
Oh, your arms as well.
It affects 1 in 5 children.
So what we're saying is what you've tried so far hasn't worked.
Yeah.
Right? I'm very, very sympathetic when kids have got skin problems because I've had an experience with my own son, okay? So I know what that feels like as a parent when you see your child itching and you're struggling.
Yeah.
I get it. It's a horrible feeling. Do you need help, Rachel?
No, I don't think there's anything that I need help with.
So you've got a clean bill of health?
Yeah.
I guess it sounds like the focus is mainly going to be on Dad and Lucas.
Yeah.
Rangan wants to find out how Ray's currently managing his back pain.
I'll be 100% honest with you. I take over-the-counter meds for fun, painkillers, because that's when, you know, I might wake up in the morning when I'm uncomfortable, my ankles hurt, my back.
When you say for fun, can you be a bit more specific? I mean, how many?
I'll go up in the morning, I'll 4 of them in the morning.
Ray starts the day by taking the anti-inflammatory ibuprofen.
So 800 milligrams.
Yeah.
And how many times do you do that in the day?
Probably twice a day.
Twice a day?
Yeah.
On this?
On that, yeah.
Pretty much every day?
Every day. She's just paracetamol.
Paracetamol and caffeine. Okay, how many of these are you taking?
Probably 3 of them in the morning, 3 of them.
3 of these?
Yeah.
I mean, the dose on here is 1 or 2 tablets every 4 hours, so you're taking 3 in one go.
Yeah.
It sounds like you're aware that that's over the recommended dose.
Oh, without doubt. And this is not, I'll be 100% honest with you, this is not a recent thing. That's probably last 10 years. So I've started off with the recommended dosage and I've gone up and up.
These drugs might be available over the counter, but by taking over the recommended dose for so long, Ray could be at risk of serious side effects. But these aren't the only pills he's using.
Talk me through some of the others. I mean,
yeah.
I can see that there, which is a lot stronger.
Yeah.
So this is cocodamol,
Yeah.
and the highest strength that we have. Honestly, how many are you taking?
2 of them every night.
Anything stronger than this?
Yeah, then was prescribed tramadol. Again, that was to use in cases when they don't work.
This is stronger than the cocodamol, and 2 of them is 100 milligrams. Yeah. How much are you taking a day?
I tend to only take them probably a Saturday and Sunday, or maybe Friday, depends.
So basically, at the weekend,
Yeah.
you're taking 2 of these in the evening.
Yeah.
But you're also taking this at the same time?
Sometimes, not all the time.
Okay.
I tend to either have them or them.
Look, I mean, there's a lot here, isn't there?
There is a bit more somewhere. I've got stronger ones, they're the 100 milligram ones. I'll be 100% honest, and this is why I'm reaching out for your help, is I've got to a stage where I'm taking that dosage that I'm telling you, and it's not really working.
Tramadol and cocodamol contain chemicals that belong to a family of seriously strong painkillers known as opiates. Abusing them can have life-threatening effects on the brain.
Some of these are addictive drugs. Okay? And if you've been prescribed some of these since 2010, what we're looking at 5 years, do you think you may be addicted to opiates?
No.
Okay.
You can say that, yes, I'm dependent on that. I will never believe that.
Okay.
And that's only because of the type of person I am. I believe I've got the power to do whatever I want. I can stop taking them tomorrow, which I've done.
I've got to be upfront with you. That is a huge amount of painkiller. Where are you getting them all from?
Majority are prescribed. They're on a repeat prescription, or I can get them from anywhere.
From anywhere?
You can get them off the internet.
Right, and do you do that?
I have done, yeah. I've done that in the past, yeah.
I don't think we should beat around the bush. That can be pretty dangerous. That can have some serious consequences.
Yeah.
I've got to be upfront with you.
Of course, yeah. I understand that. And
right at the start of this process, I've got to be blunt and upfront with you if we're truly going to have a relationship that allows us to move on from this. That's been frankly very, very eye-opening for me. Opiates are really strong painkillers that actually belong to the same family as heroin and morphine. Now, yeah, they can be very effective at managing pain, but the problem is they're highly addictive. Not only that, but he's buying these things online. The problem is when you buy drugs online, you don't know what's in them. Even if it is the right drug, you don't know if it's past its sell-by date or not. The only safe way to take prescription opiate painkillers is to get them prescribed and managed by your doctor.
Almost 2 million people in Britain have misused prescription painkillers in the last year. Ray's long-term pain is an issue the whole family have to cope with.
reading between the lines, it must be affecting him hugely.
He is in pain, but he's not like rolling around in pain all the time. It's just, I think he's just used to it.
Is that hard for you to cope with?
He has got a temper, because I suppose because he's tired all the time because he doesn't sleep because of the pain. It's not necessarily at me, it's more at a situation.
Yeah.
It's not really aimed at me.
No.
And so I don't know. I mean, sometimes I worry about him at work. I think he's going to come home one day from work and maybe he's sort of going to punch somebody.
Right.
In a meeting and things like that, because he wouldn't.
Does he get angry?
Just because he gets so worked up when he's trying to get a point across and people aren't listening to. And I just think a lot of that is just down to his stress levels and things like that.
It's really interesting hearing your perspective. If there was just one thing that would change in the next 4 weeks, what would that be?
His pain.
His pain?
Yeah, help his pain. Because then I think that'd have a knock-on effect with the sleep and the stress.
I'm inclined to agree. If his pain went down, it'd be interesting to see what else gets better as well.
In spite of his debilitating pain, Ray works out every day.
When did you get into bodybuilding?
Actually, you got into bodybuilding about early 20s.
Early
21,
20s?
20.
When you started going to the gym?
When I started going then properly.
Yeah.
I always remember I was 10 stone 2, but then also the combination of, I knew I had a bit of an issue with my back. I kind of thought if it, straighten up, because I get a bit of advice from them, because they'd been to training and said, what you might do is start building your core up and you'll probably find it'll help your back out. So I thought, well, OK, I'll give it a go.
I've not had that much experience with bodybuilders. He's very, very big. I'm not sure whether there is maybe some steroid use going on. I want to find out, is his relationship with his gym healthy, or has it gone too far? Is it actually quite unhealthy now?
Make yourself at home.
Oh, perfect, thank you. Fantastic. I'm feeling pretty drained, actually. I think there's a lot to sort out here. I think these issues are quite complex. I think some of these issues have been going on for years and years. And actually now, I'm slightly worried how much of this I can unravel.
Rangan wants to observe every aspect of Ray's life, so he's staying the night to be with him for his usual 5:30 a.m. start.
Good morning. Hope you have a good sleep.
Yeah, not bad.
Made your tea.
Oh, perfect. Thanks
No
so
sugar,
much.
no milk.
How was your sleep, by the way?
A bit 100 mile an hour in my head, so a bit restless here, there, never, but nothing major, but everything that's going on, just so
Still in the head, yeah. I'm just going to quickly get myself ready, and then I think, are you ready for work?
Yeah, well, I'm going to open the gym first, and wait till my day manager gets there, and then I'll just head up to where I work.
Right, so I'll just jump in the shower, and then maybe I can follow you today.
Of course, yeah.
So
All right, nice one. Yeah, look forward to it. Yeah, thank you very much. Enjoy your tea.
Cheers, thanks. I think by most people's standards, pretty early start, and if he's not sleeping well and he's getting up this early, I wonder how much rest and recuperation he's actually getting.
The first stop in Ray's busy day is his gym.
Typical morning, you open up, you wouldn't have a workout at that point.
No, I don't. No. I'll have me protein drink, go down, open up, wait for me day manager to turn up. Yeah, you're not here to do any training.
So how long have you had this open now?
It's been open approximately 2 years now.
And you've been training for, what, 25 years?
25 years, yeah. I first went in around about 16, 17.
Yeah.
Walked into a gym, didn't like it. It was quite intimidating. I was a very, very slim person, very small. I'm only 5'6" and a bit.
Is that why you started?
I think that's the reason I first went into a gym.
Because if someone looks at you now, they at no point would think you're tiny and slight and...
I don't actually think that. When I look in the mirror, I still think I still see that little skinny lad that started. Yeah.
Do you think that's part of the drive to keep working out and keep getting bigger?
I'll be honest, I've been on a course of steroids before now, and I've gone up to 16.5 stone, but I still didn't believe I was big. I still thought I was that 10 stone 2 person that walked into a gym.
So the initial reason to take steroids is to get bigger?
Yes, it was to get bigger. The example I always use is, I always say, you will never see yourself grow, but you see yourself shrink.
It's estimated that nearly 60,000 bodybuilders use steroids in England and Wales alone. They can be very dangerous, increasing the risk of heart attacks and high blood pressure. Ray may not take them anymore, but it's clear that being big is still very important to him.
He told me that when he looks at himself in the mirror, he sees that thin,